Curious about what it takes to dissolve filler? Let's talk about it. So, when I say filler, I mean hyaluronic acid. What we use to dissolve hyaluronic acid is hyaluronidase. Hyaluronidase is an enzyme that breaks down hyaluronic acid. There are 3 FDA-approved hyaluronidase products in the United States. The one that's most widely used and that I use here at Bijoux Med Spa is Hylenex. Hylenex is a human form of hyaluronidase, meaning it's very similar. It's genetically engineered to be similar to the hyaluronidase that is found in our body. So it is the one that is least likely to potentially cause an allergy. The other two, which is vitrease and amphidase, are animal derived. So maybe a little bit higher of a risk to cause an allergy. Now, on to that point, at my med spa, I usually do a little test spot here on the inner arm whenever a person comes to me wanting their filler dissolved, just to make sure that they are not allergic. Even though I use Hylenex, which is the recombinant human form of hyaluronidase, I still like to do a test spot. The chances of being allergic to it are less than 0.1% or 1 out of every 1,000, but I like to be safe, and I always do a test spot and wait for 30 minutes prior to injecting a large amount of Hylenex into someone's tissues. So as I said before, hyaluronidase breaks down hyaluronic acid. It does not break down things like Sculptra, which is PLLA, polylactic acid. It does not break down Radius, which is calcium hydroxyapatite. It does not break down products like Renuva. So it will only break down hyaluronic acid-based products, Juvederm, Restylane, Versa. There's many different types of hyaluronic acid fillers that are FDA approved on the market nowadays. So who is a candidate for hyaluronidase? I'd say anybody that's wanting to dissolve their hyaluronic acid filler. So what do we use hyaluronidase in practice for? Or why might you be interested in having it done? So we use it for bad filler, poorly placed filler, too much filler, or for complications that are caused by filler, such as vascular occlusions or vascular compression, unwanted swelling, things like that. So of course, let's talk about just poorly placed filler. I see probably the number one area, yes, the lips is the number one area. Lips are such a small, delicate area. It is very easy if you do not have a smooth hand and use the right products and in the right depth to experience unevenness, lumps within the lips, migration within the lips. So the number one area that patients come in to see me wanting dissolved here in the practice is lips, but a close second is under eyes. It's why it's very important to go to an experienced injector for actually either of those areas because they're both quite difficult, but especially the under eyes are a difficult area to inject. Not every person is a candidate to receive under eye filler. And so when I see people that aren't a good candidate that have received under eye filler, or even if they were, the wrong product was used or it was used in the wrong plane, too much was used, and you can wind up with complications such as puffiness, under eye swelling, bags, lumps, or weird shells. So thank God that we have hyaluronidase on hand so that we can dissolve these complications that happen in these areas. Here at my med spa, I actually use hyaluronidase often in combination with ultrasound. So with the ultrasound, it helps us locate exactly where filler is because it is hypoechoic, so it comes back with darker spots, so you can see where the filler is placed in the tissue, so you can deliver more precise treatment with a hyaluronidase. So you don't have to use as much hyaluronidase. You can be more specific, more precise with it. So I like using ultrasound whenever I'm administering hyaluronidase. Another reason, as I mentioned, that we might use hyaluronidase is for migrated filler. So even if you go to a great injector and you love your results for years, just due to aging and changes in our tissues and movement within our tissues, the filler can slowly migrate to areas that we didn't intend it to migrate to. Yes, the placement is important. The type of product that is chosen at the beginning is important. If you miss on both of those, the placement and the type of product, yes, migration can happen more quickly. But even if the injector does everything just right, migration can still happen over time. I got my lips first done when I was 20 years old. I'm now almost 40, and I went through a deleting process in my early 30s where I just dissolved everything because I started to have a little bit of migration. And I probably received like 4 or 5 syringes in between that time from when I was 20 to like I was 31 or 32 when I just dissolved everything and started over, just because tissue changes and things shift. And so I just wanted to dissolve and start fresh. So some people, they just want to get a refresh. And another very important reason why we need to keep hyaluronidase around, any provider who is injecting hyaluronic acid has to and should have at least 8 vials of hyaluronidase in their fridge. And you should ask your injector about this. If you are going to see an injector, you need to ask them how many vials of Hylenex that they have on hand. And if they say less than 8, don't get it done, because if a complication arises, such as a vascular occlusion or even sometimes a vascular compression, it can take up to that amount, especially if they don't have an ultrasound on top of that to be precise and maybe locate where the occlusion is, in order to dissolve that filler so that we can resume perfusion of blood to our tissues. So it's very important that you have hyaluronidase on hand if you're injecting hyaluronic acid fillers. This is specifically when we inject the hyaluronic acid gel by accident into an artery. That gel clogs the artery, therefore blood, oxygen-rich blood, cannot flow through that artery and therefore nourish our tissues. If nothing is done, that tissue will die off, scarring will happen. So we need to make sure that we have that on hand, that God forbid, if a emergency situation like that arises, that we have enough hyaluronidase to inject and diffuse into that area to help break up that occlusion so that we can resume perfusion to the tissue as soon as possible. So what does a hyaluronidase or filler dissolve appointment look like? Well, here at Bijoux, whenever you come in, we have a patient wash their face, we apply a topical numbing cream, because as you may have heard, the pH of Hylenex or hyaluronidase, it can sting a bit. So we will either do dental blocks if we're dissolving lips. If the patient doesn't want dental blocks, we can just do the topical numbing. So we'll apply topical numbing over the area or do blocks if at all possible. We'll also sometimes mix the hyaluronidase with a little bit of lidocaine to help with the sting. So we do everything that we can to make you as comfortable as possible. Usually my patients will say it doesn't hurt any more than the filler they've received in which we're dissolving. So pretty tolerable appointment if proper numbing is done beforehand. I oftentimes will use my ultrasound to help guide me to the specific plane of the tissue in which the hyaluronic acid is that we're trying to dissolve. I can use less product because of that and be more precise, which could cause less damage to the tissue. So I like using an ultrasound whenever I am doing a filler dissolving with hyaluronidase. So once the hyaluronidase is injected, it works quickly. We're talking about within 5 minutes. It does most of its breaking down of the hyaluronic acid. By 24 hours, the enzymatic activity of the hyaluronidase has really completed its job and it's not breaking down anything more at that point. Then it's just the tissues healing. So, and it's your body absorbing what has been broken down. So that's why we like to wait 2 weeks before we do any more dissolving to let the tissues heal, to let any residual inflammation just from the injury of poking you with a needle and injecting the hyaluronidase in there to resolve and to calm down. So even though the hyaluronidase has done its job within 24 hours, we like to give the tissues a chance to heal. And that's why I wait 2 weeks before we decide to do another dissolving session if it's necessary. So a controversial topic around hyaluronidase is, does it destroy, harm, or destruct our own natural tissue? So let me remind you, hyaluronidase is an enzyme that strictly breaks down hyaluronic acid. And yes, we have hyaluronic acid naturally within our tissues. So after hyaluronidase is injected, it can break down not only the exogenous hyaluronic acid, so the filler that was placed within your tissue, but it can break down your own hyaluronic acid. There's no precise way to answer that. But what I can say is that there's no published reports that support that hyaluronidase breaks down our own tissue or causes permanent tissue damage after hyaluronidase injections. I do have a couple of thoughts as to why this can be, though. The first one is just tissue expansion. And then when you erase or delete that filler with hyaluronidase, the tissue is more lax. So if at your baseline, you got filler, and then you expanded that tissue with filler, it's kind of like weight loss. You were a certain weight, you gained weight, you lost weight. Now that tissue is more flaccid, it's more loose, it's lost elasticity. So I think that's one thing that could be happen is you were at your baseline, you got a lot of filler, maybe too much, or maybe you just didn't like it and didn't look good. You erased it and now you've lost some elasticity and you have more plasticity within your tissue. The second thought that I have is that if you were 30 years old when you first started getting filler and you decide to erase it when you're 45 to 50. Well, now there's 15 years of time that's elapsed with in between you getting your first syringe of filler and maybe syringes in between to maintain your look. So aging has taken place. So then when you dissolve, and let's say you just want to start over, or maybe you had some undesirable results with a certain treatment later down the road and you want to dissolve and start over, now your tissue has aged between that time from when you were 30 years old to now when you're 45 and you're deciding to erase everything. So once you erase that filler that's been supporting your tissue is going to look older than your baseline because now it's been years that have passed. So those are a couple of reasons why I think some patients feel that they look worse after they have the hyaluronidase dissolved than when they were at baseline before they got the filler. I hope this answered a lot of questions for you. If you have any lingering questions, feel free to reach out.